Tendinitis is the inflammation of a tendon. Today we are going to be talking about supraspinatus tendinitis. The supraspinatus is the most commonly injured rotator cuff muscle. The supraspinatus tendon originates from the supraspinatus fossa of the scapula and inserts into the superior aspect of the greater tubercle of the humerus. It initiates and aids the deltoid in abduction of the arm and the shoulder. It also stabilizes the shoulder by drawing the humerus towards the glenoid fossa.
The supraspinatus tendon is usually injured in overload combined with muscle imbalance and/or repetitive use and trauma. Little swelling is visually evident at rest. Palpation of the area will reveal swelling of the tendon, often at the tip of the shoulder, where a sharp pain might be felt. If pain is felt on resisted abduction, the tendon is injured at the musculotendinitis junction. If pain is felt on the passive elevation of the arm, the tendon is injured at the deep distal end.
When dealing with tendinitis, rest and non-steroid anti-inflammatory drugs are the best treatment. However, strengthening and stability exercises of the surrounding muscle along with increasing range of motion is useful. We will start on just a terminal stretching program to increase the range of motion. The range of motion is used to gain full movement of the joint. Without going through full range of motion, the joint does not get nourishment from the synovial fluid, increasing the risk of osteoarthritis. These range of motion exercises can be done at home with the use of household objects. For this particular one, take a broomstick handle or a golf club or anything of that sort. Elongate your hands straight up and go all the way from your belly to your overhead with your elbows straight. Try to elongate the shoulder girdle. Repeat this exercise 15 to 20 times before you do any sort of strenuous activity. This exercise is to loosen up the shoulders. Using the same broomstick, hold it behind your back. Make sure your trunk is nice and tall and lift your arms straight off your backside. Continue this for 15 to 20 seconds. This is not a wide range of motion. It is common to feel a small pull at the top of your shoulder. As this exercise becomes easier, bring your hands closer together until they actually touch each other. The closer together your hands get, the more intense the exercise gets. Continue this exercise again for 15 to 20 seconds, or 15 to 20 repetitions. A variation of this exercise would be to pull your arms up along your back and elongate your shoulders just a tad.
This next exercise is an internal rotation stretch. The towel should be placed in a vertical position. Use the uninvolved shoulder to assist the thumb up the center of the back. No agony should be felt here. Hold for 30 seconds and repeat on the other side. 10 to 15 reps should be done twice a day. The next external rotation stretch can be done by turning the arm away from the body, which can be done in a door frame. Place your arm at 90 degrees and push your body forward. Hold for 15 to 20 seconds and repeat on the other side.
This is a shoulder abduction strengthening exercise. Strengthening the abduction motion is important because it is the range of motion that is most commonly injured with supraspinatus tendinitis. For this exercise, lie in a side plank position. Keep your palm and thumbs down and close to your body with your elbow extended. Raise your leg at a 90-degree angle. Slowly bring the arm up to knee level and repeat this 15 times for 3 sets. There should be no pain felt when performing this exercise. Once you have mastered this, you can add a weight. Be sure not to use a weight that is too heavy. Start with 2 or 3 pounds. Keep in mind that we need to change our weights and amount of sets and reps every 2 weeks, or we will plateau and sometimes even detrain. This is important for all of our exercises shown today.
We need to strengthen the muscle by causing a contraction. We contract the muscle in a way that doesn't encourage impingement. Start off with a 2 or 3 pound weight, making sure that thumbs are pointing down. Then move them up as the arms are brought to shoulder level. No higher or else you risk impingement. Do 3 seconds up and 5 seconds down in order to gain muscle stability and control. We recommend 3 sets of 12 reps, but trial and error is best to determine the amount best suited for the individual. After mastering the 2 to 3 pounds, start to increase weight to 5 or 8 pounds. Once you're done with the 8-pound weight, you can start the eccentric muscle stretching. This is when you're up for 3 seconds and quickly down for 1. In order to reverse tendinitis, we need to eccentrically overload the muscle. So we use a muscle contraction to deaccelerate. We recommend 3 sets of 12 reps, but trial and error is again best for the individual strength and level of injury.